All right, family, God bless you. Yes, it's the time you've been waiting for. Senior Talk with Claire Hubbard, your resource and information show for people getting better with age. Well, let me tell you, we are back at it again. This is one of a three-part series. Last month, we kicked off AEP, which is known around the world as Annual Enrollment Period. And oh my goodness, there is something called the Medicare maze. But don't fear, we have our experts here, our gold sponsor, Zing Health, where health is reimagined. Joining us again is my sister friend. Let me tell you, Miss Sadie, how do you say it? Sadia? Sadia. Okay, I got to get that right. Sadia Selvey, busy woman, still classy as always. And let me tell you, we're not going to miss anything. We're also going to dig in a little bit deeper about the great benefits that you are entitled to. Some of us don't be afraid. Some of us are scared. Oh my goodness, I don't know. Well, we have a Medicare consultant expert, and she is the Vice President of Sales and Marketing for Zing Health. Boom. So we get it all covered in this one show. Everyone stay tuned. Senior Talk with Claire Hubbard. We'll be right back after this message.
Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
All right. So we got a little bit out the way. Zing Health is turning 65 again. They just stay 65 and doing it well. Well, I am very excited once again to bring back and to join us once again is my sister friend, Miss Sadia Selvey. As I mentioned, she's Vice President of Sales and Marketing for Zing Health, where health is reimagined. And I am very excited. I told you in our virtual green room, I just want to send a special shout to the benefit counselors. Let me say the consultants, benefit consultants. I have been several places in the last 4 days. I have seen some person or a group of two or more collectively bringing the message about Zing Health, from movie theaters to grocery stores, you name it, in front of other businesses that allow you to come and just bring the message. So congratulations, the benefit consultants. I'm cheerleading you right now. Thank you, thank you, thank you. As I told you in our virtual green room, Sadia, I walked up and it's just, first there's a genuine smile. Hello, how are you? They don't know who I am. Sometimes some of them do, but that's what you want. You want something, a company or organization that represents you even in your absence. And so on the outside, they take care of Zing really, really well. So I just want to give you that shout because I know you've all been working hard to bring the best of consultants and benefit to the community. So shout out to you and congratulations on that.
Thank you. Thank you. And that's very important, Clara, because we're out in the communities. We sponsor over 300 events per month, just out there in the communities, educating Medicare beneficiary about their options, about Medicare Advantages, plans, about resources that they might be eligible for, like saving, money with their Part B premium or extra help. So our Medicare consultants are out there in the service area. You'll see us. Come and say hi if you see some of our Medicare advisors out there. But it's really important to, be in those communities.
Absolutely. And so one of the things that we have been in partnership for the last maybe close to 2-3 years now is that there has always been a consistency that the founder, Dr. Eric Whitaker, stands on. And that is health equity and health access.
Yes.
And I am so honored because I had a chance to talk with him briefly, meeting him again at an event, and that's still in place, health equity and health access. So before we dive into more of our meat of our programming today, let's talk about that distinction that Zing sets apart, where you reimagined.
Absolutely. So one of the things that Dr. Whitaker, when he started Zing Health, one of the things that he looked at is health outcomes in the minority communities among Medicare Advantage or Medicare Advantage members or Medicare beneficiaries. And one of the things that he saw is that there was a lack of presence of African Americans in Medicare Advantage plans, only at about 19%, whereas nationwide it's more so around 36%. And so that led him to do further research. And he also found that African Americans or, people of color didn't necessarily see the health outcomes that their counterparts saw when they joined Medicare Advantage plans. And so in further research, it really has to do with access to quality health care, access to the right benefits to promote health outcomes. But one thing that he did take into consideration, which I think distinctively defines our plans, is the fact that we address social determinants of health, because those are things that really impact our community, whether it be economically, socially, connecting resources. Social determinants of health make up impact 80% of health outcomes. Wow. And so it's very important that those things be taken into consideration, which are outside the realm of medical care. It's things like, can I afford my medications? Do I have transportation to the doctor? Can I eat healthy with the budget or the money that I have on a monthly basis to support me? So we thought about those things, those different social determinants of health, like in-home support, to assist with social isolation and depression, as we saw during the pandemic. And so that's the unique identifier when it comes to Zing Health, is that we have taken these things into account. So now we can serve individuals from a holistic standpoint as opposed to just medical.
Absolutely. And that's what we're going to talk about more in our programming, is that Zing Health, we've been to many expos together throughout the states, and some people are just really surprised that you have more of a, you take the personal family approach. What I would like my loved one to have, in regards to medications and food and things of that nature? You've taken that approach, and I think it's really wonderful. So without any further ado, let's get to our presentation, because we have some things that we want to share with you as a community. We do invite you, as you are watching on Facebook, LinkedIn, and Twitter, if you have any questions, you can definitely put us in our chat, and we'll try to get those answered for you. But also in the interim, if you would like to forward anything via information to your network, because a lot of you have social groups and church ministries, and you need an expert that could answer your questions, we do invite you to call the Senior Talk office at 312-428-6919, and we'll be glad to get someone from our Zing Health partners to come and speak to you, because group presentations is always a benefit, and they would love to be of service to you. So we have a presentation, as I mentioned, and let me tell you, it is by far none one of the most thorough things that we can do. So if we could, I'm going to sit on behalf of, let's say, a person looking for services for their loved one, and let's talk about what we're looking at today. So now we're talking about, let's make Medicare simple.
Right, because most of the time you hear a lot of people say that Medicare is really complicated to understand, and we call it navigating the Medicare maze. Ooh, yeah. But one of the things that we try to do is educate, whether it be a Medicare beneficiary, an advocate, a caregiver, on how Medicare works, because it's important to understand the out-of-pocket costs associated with Medicare. It's important to understand the things that Medicare cover, as well as the things that Medicare does not cover. It's also important to understand why it's important to sign up at the time that you're initially eligible to sign up for Medicare, because if not, Medicare does assess penalties along with, late enrollment into Medicare. And so there's a plethora of things that really impact Medicare beneficiaries that we in turn educate them about, so that they're at least aware. And one of the things that we try to do is, as it stated, is make Medicare simple. So Medicare is a federal health insurance program. And most oftentimes people think it's a program specifically for seniors only. But Medicare actually serves people who are 65 and over, people who are under 65 with certain disabilities, people of any age with end-stage renal disease or permanent kidney failure that requires dialysis, and then people who have Lou Gehrig's disease or ALS. And so those 4 categories of individuals all qualify for Medicare. So it's not just the senior population. So we remove that stigma of thinking that it's only insurance for seniors. There are a number of eligible people under 65 that also qualify. Typically, if someone has worked at least 10 years or 40 quarters, they automatically receive Part A. And sometimes if they have not worked, they could earn Medicare through their spouse who have worked at least 10 years or 40 quarters, and they've been married to that spouse at least 10 years. So individuals may qualify that way when they become 65 or older. Now, you earn Medicare Part A premium-free outright if you qualify based on working those 10 years or 40 quarters. When people retire or become eligible for Medicare Part B does have a monthly premium associated with it. And in 2023, that premium has dropped to $164.90, which I think is important because the premium was a little higher this year at $170. And so that premium has been reduced to $164.90 for 2023. So again, it's important for Medicare beneficiaries to know that, because they'll see a little bump in their Social Security checks as a result of the cost of living increase as well.
Wow. So I've been doing this show for 11 years, so I've been doing this over 40 quarters. Lord have mercy. Just brought that to my attention. All right. That was something else, but all right. So are we on to the next slide?
Yes.
All right.
Here, this is just something that I want to touch on, because oftentimes when we talk to individuals about how Medicare works, a lot of times people don't understand the out-of-pocket costs associated with Medicare and how Medicare Advantage plans can impact costs. And so with Medicare, the most important thing to understand with Medicare from a cost structure standpoint is that there is no limit to what you pay for original Medicare, which is Medicare A and B. And we'll get into what those things cover in a little bit. But it's important to know that in 2023, if a person has original Medicare and they only have original Medicare insurance and they don't have, any additional coverage, whether it be from an employer, retirement benefit, a Medicare supplement plan, if they don't have other insurance such as a Medicare Advantage plan, they'll be subject to these costs. So if an individual were to go into the hospital for any reason, it does not work the way Part B works, because when I ask people how Medicare Part A works, they say, oh, I have a 20% coinsurance. That's Part B. So with Part A, if they were to go into the hospital for any reason on day one under original Medicare, they're going to pay $1,600 deductible on day one of any inpatient hospital admission. And again, there's no limit to the number of benefit periods you can have in a year. So that means that every time they go into the hospital and 60 days elapse, they have to pay that deductible all over again. So that deductible doesn't go away. And then let's say if someone were in the hospital past that 61 days, if you can see here, they're going to have to pay $400 per day for days 61 through 90. And if they're still in the hospital, for days 91 through 150, it's an $800 copay per day, and then all costs after day 150. And I think we talked about it before, and which this is actually what fueled my passion. When I sold Medicare Advantage plans many years ago, I met a gentleman who his house was being seized or put a lien against by the hospital because he had had a stroke. And he had been in the hospital for over 3 months. And I had never heard that before. And I was literally in shock. But it made me understand that. And he said, at the time, he said, where were you 3 months ago? Because the number one thing that I would suggest and say what the advantage is in terms of Medicare is the fact that Medicare Advantage plans have a yearly limit on what you pay out of pocket for Medicare Part A and B. So off the bat, with a Medicare Advantage plan, you know that your Medicare costs are capped at a certain limit. So it's important to know if you're on a Medicare Advantage plan, what your maximum out-of-pocket costs are. Because if you ever meet your maximum out-of-pocket costs, your services under Medicare Part A and B will be covered at 100% for the remainder of the year.
Wow. I've never heard of such.
Yeah, it's absorbent. And that's why we educate individuals on how Medicare works, because until you understand how it works, you don't understand that there's need for additional coverage.
Yes, yes, yes. All right. Well, wow, that really has shook me, because I could only imagine how he could have felt being and not knowing that this was happening to him. Did they succeed, or what was the outcome on that end? How did you all step in, or how was that matter resolved? And that's what I want to ask.
Well, that's the thing. It was not, because he was under original Medicare at that time. So you're subject to all of these gaps or out-of-pocket costs, which is why they call supplemental insurance Medigap insurance, because it helps to cover the gaps in Medicare. And as you can see, there's quite a few gaps if someone were to be in a hospital for an extended amount of time.
Wow, wow, wow. All right. Well, let's go to the things to consider when choosing the plan.
Yeah, so these are things that, we like to help people to understand, because a lot of people don't understand the difference between original Medicare and a Medicare Advantage plan. So first and foremost, under original Medicare, again, as we just discussed, there's no limit on how much you pay out of pocket per year. Whereas with the Medicare Advantage plan, you have a yearly annual maximum out-of-pocket cost associated with your care. And once you reach that limit in a calendar year, your services that you receive that are covered under Medicare A and B are then covered at 100%. And so when you talk about what those maximums look like, most of our plans maximums are under $4,500. And so that gives you a safety in knowing, if something happened where I had to stay in the hospital for an extended amount of time, my maximum out of pocket would be this amount. And it may not even be that high depending upon the Medicare Advantage plan you're in, because they under Zing, they have different maximum out of pocket costs associated with it. Another thing is that with Medicare, original Medicare, it covers your Medicare Part A and B, which is your hospital and medical services. But the Medicare Advantage plan takes it a step further and not only covers your Medicare Part A and B, which is your hospital and medical care, but it also adds additional benefits at no additional cost in most cases. Things like Medicare Part D, because Medicare Part A and B does not include your prescription drug coverage. If you get it under a Medicare Advantage plan, most oftentimes it'll be automatically included, and there'll, in most cases, be no additional premium associated with getting Part D.
That's a big one.
That is a big one.
Prescription drug costs. I mean, you can advocate for that year long, and it will not be underserved. It's going to still be underserved and underappreciated, that Advantage plan, including medical drug costs. That's a big one.
That's a huge one.
I'm not emotional. I'm sorry. But
no, this is interesting. And also, if someone has a Medicare supplement or a Medigap policy, if they join a Medicare Advantage plan, they no longer need that Medigap or Medicare supplement policy, because with the supplement comes a premium, a monthly premium. So most people who have a Medigap or Medicare supplement plan, they're paying an additional premium in addition to their Medicare Part B premium. It does not come with prescription drug coverage. So potentially those Medicare beneficiaries will pay 3 separate premiums. They'll pay their Part B premium, their supplement premium, as well as their Part D premium. And with the Medicare Advantage plan, it's all in one. And typically it's at 0 to low monthly plan premium. And some people say, well, no cost, it's no monthly plan premium. Here's the thing, it's not free, because while you were working as a Medicare recipient, you were working, Medicare was taking money out of your check. That was going toward paying for your Medicare insurance. Now that you're retired, or now that you receive Part B, you pay a monthly plan premium. What you paid into Medicare and the money you currently pay into Medicare funds Part C. So it's not free. You're entitled to the benefits by right of paying into the benefits. So that's why you can join a Medicare Advantage plan for no additional monthly premium, because you're already paying into Medicare.
Right. And you've already, like I said, you're entitled to it and it's already yours. So why not?
Absolutely.
Okay. Wow. This is phenomenal information. All right, that beautiful blue, red, white, and blue card. Let's talk about that.
Absolutely. So when a person becomes eligible for Medicare, or if they have Medicare and they're interested in enrolling in a Medicare Advantage plan, they have to have both Medicare Part A and Medicare Part B. I've met individuals who wanted to enroll into Medicare, but they only had Part A or they only had Part B. In order to enroll in a Medicare Advantage plan, you have to have both Medicare Part A and Part B. And if you're joining a Medicare Advantage plan, you have to join a Medicare Advantage plan based on your service area. And so for Zing Health, our service area is listed below. We're in Illinois, Indiana, as well as Michigan. And in Illinois, we're in the Rockford area, which consists of the Boone, McHenry, Ogle, and Winnebago counties. And of course, we're in Cook, DuPage, DuPage, Kane, Kankakee, and Lake counties. So those are the 11 counties for Illinois. And then in Indiana, we're in Allen, Lake, and Marion counties. And then the greater Detroit metro area for Michigan, including the Flint and Oakland areas as well.
All right. And so we're just going to take a small pause because we want to hear those words from our founder, the man himself, Dr. Eric Whitaker.
Well, this year we started in January 1st, 2020 in Cook County only. Starting January 1st, 2021, we'll expand to 6 additional counties here in Illinois. And we're excited. We're going to be moving to also go to Michigan, where we'll be in Wayne County, Oakland County, and Genesee counties, and also to Indiana, where we'll be in Marion, Allen, and Lake counties. So we're only been in business going on 2 years, and we're expanding our footprint across the Midwest pretty dramatically.
Well, we can agree to that. And it's been more than 2 years now. How many are we celebrating now?
Yeah, we started in 2019.
Okay.
And so we've been in business well over 3 years, and we're really excited about entering the market and providing unique services to benefit some of the residents and communities that we serve. We're really excited about the expansion, and we're expanding even further.
I can't wait. All right. So we can move to the next slide?
Yes.
Okay.
And I'll say this as well,
yes.
Clara, we did purchase another company called Lasso Health in 2021, and they're currently representative in more than 36 states in the United States. So we also are in 36 other states outside of Illinois, Michigan, and Indiana for our Medicare Medical Savings account program. And that is also a Medicare Advantage plan. It's a separate line of business.
Well, I'm with the right group at the right time. I tell you, we just like family. All right. So that's good. Now, all the benefits you need under one plan, we've already talked about it. But if we could bring back one day, Luana Peters, she will cheerlead on all of these things because she talked about how the services were very beneficial to her. As you mentioned, during isolation, during COVID, where were we? How could you help me? What did you do? And she cheerleaded for that. And we're going to bring that show back in the future just for a recap. But go ahead and explain all the benefits under one plan, under Zing's Reimagine.
Absolutely. And so as we talked about it, Medicare does not cover certain benefits. So for most Medicare beneficiaries who are looking for things like dental benefits and eyeglasses outside of having a cataract surgery, transportation, and those other essential benefits, Medicare does not cover those benefits. So another advantage to enrolling into a Medicare Advantage plan is that you can get additional benefits that's not offered or covered by Medicare. With Zing Health, most of our plans cover things like what's called a PAPA benefit or in-home senior support, and it provides support within the home. So things like assisting that Medicare beneficiary or member with transportation services to the grocery store to pick up their prescriptions, to help with respite care, all of those different things that provide in-home support. Most of our plans cover that benefit. There's also a grocery benefit because we see and know how people were impacted due to the pandemic in terms of food and groceries. So we do have a grocery benefit under our plans. And in order to qualify for that benefit, an individual must have a chronic condition. Now, we talked about access. Medicare requires carriers that anytime you offer a benefit associated with food, it has to be tied to a chronic condition. So Medicare has about 15 categories of chronic conditions, and most plans opt to pick about 3 or 4 of those conditions. We picked all 15 just to ensure that as many people that could access this benefit under our plan would access it. And
I just want to make a point. Some people are not familiar with the term respite care. And I just wanted to mention this. This is also National Family Caregiver Month. And normally when you hear respite care, people say, well, what is that? Well, respite care is a service that if you are caring for a loved one or someone in home, or if you're a family member of someone and you need a break, not a break from the situation, but just a break for yourself, to return to yourself, to refresh yourself. That's what respite care is. It's really more noticeable in those terms of hospice and palliative care, where respite comes in, you're caring for a loved one 24 hours. It allows you to take a break to go to the hair salon or read a book or just catch up with friends. So, and it's a huge, huge benefit. It helps you to refresh yourself, to come back to your loved one and be refreshed to care for them. But it's also untapped, and it is at no cost. So you have to tap into that. I just wanted to mention that. But respite care is truly a big benefit, especially to those in hospice and palliative care, or if you're caring for a loved one. Thank you very much.
Absolutely. Thank you for that, Claire. And also, one of the things that we did, because, and we'll talk about diabetes if we get an opportunity to, but one of the things that we looked at is managing diabetes, our members under our plan who are managing diabetes. And sometimes in order to manage diabetes, and it goes back to social determinants of health, if you cannot afford the cost of insulin, that impacts your ability to manage diabetes. So one of the things that Zing made a decision to do earlier this year is we moved all of our insulins that were on tier 3 at a $35 copay to tier 1, which is now at a 0 copay. And let me tell you why that's important, because some people who do not qualify for extra help, they fall into the coverage gap early in the year because of the cost of insulin. So if someone has to reach the coverage gap, that means at the coverage gap, they pay 25% of the cost of that insulin as opposed to that $35 copay. And what we've done is during the coverage gap and during the initial coverage limit, our members are going to pay no cost for our insulins that are on our formulary. So that is extremely important. And another thing that we did, there's some technology called continuous glucose monitoring technology. Yes. And it allows for 0 finger pricks. You're able to monitor sugars all day if need be by a device or by a phone. And you have access to monitor your sugars literally all day without sticking or pricking your finger with a needle. And so this technology can be extremely expensive. Zing offers this to our members at 0 cost. Wow. So we actually do want to help people with diabetes manage their diabetes, successfully manage their diabetes, but because according to the Centers for Medicare and Medicaid Services, 1 in every 3 Medicare beneficiaries has diabetes.
Wow.
And 3.3 million Medicare beneficiaries use one or more of the common forms of insulin. And so that's 1 out of 3 Medicare beneficiaries. And so again, this becomes extremely important in helping people to manage. And we're educating our members about the use of this technology because it's helping individuals, it's helping our members. And we've received several testimonies from our members at how well they're able to manage their diabetes as a result of this new technology.
Well, let me say you also, and we're looking under the benefits. I mean, you provide other additional things that can help aid in that. One is fitness program, Weight Watchers, meal benefit. I mean, those are other things that we have to do our part too. Let's be clear. We can't just say, Zing, okay, well, I got diabetes. They have put other things in place that help you to aid in decreasing and increasing your quality of life. Fitness membership, Weight Watchers, and all other things. So let's be mindful of that. And a nurse advice line 24/7. Can't get it better than that. All right, let's go on to our next slide.
And so this is really important as well because, again, you talked about access, you talked about health equity. We want to ensure that our members have access to the benefits that they need. And so one of the things that we've done is we've made it affordable, healthcare affordable in terms of important services that Medicare beneficiaries under Zing Health can access. And so this is across all of the plans that we offer. Members are going to pay 0 copays for their PCP visits. Telehealth became really big during the pandemic.
Yeah.
And we partnered with a telehealth vendor called MD Live. Not only do they provide board certified physicians who can virtually see our members at no cost, but they also provide urgent care visits as well as behavioral health visits at no cost to the member, because sometimes getting into behavioral health appointments can be very difficult these days. And so the telehealth visit covers them at no cost, as well as if a person is looking to decrease their out-of-pocket costs for their prescriptions, if they go via mail order, they're only going to pay for tier 1 and 2 medications, 0 copay for a 100-day supply of their medications that fall on tier 1 and tier 2 under the plan. Again, lab work x-rays are covered at 100%. Our formulary insulins, as well as that continuous glucose monitoring technology, is covered at 100%. And we have enhanced Part D. Any medications on tier 1 continue to be 0 cost share, even during the coverage gap. And so again, these are all very important things that really help our members to make our healthcare affordable.
This is truly a lifeline in itself to help people to continue to be as independent as possible. I'm looking at this. These benefits are this whole chart that we're looking at is 0 copay. I do know how popular telehealth visits were, and I like that you mentioned that they were certified and doctors, through the MD Live. Let's be clear, because we have to make sure that we're under an umbrella of services. Sometimes we can get referrals, yes, but I invite you and ask you to look to an expert. Our expert, Zing Health, 866-946-4458. 866-946-4458. We are inviting everyone, and we're going to share this through many other networks when our broadcast is over. But if you want more information, if you would like to schedule a presentation for your community, you can call them at 866-946-4458. Oh my goodness, this is life-changing. I am looking at everything. Mail order prescriptions.
Yes.
Insulin. Yes. I know people who are making decisions, and it's unfortunate that we're living in this lifestyle where I have to decide if I'm going to buy my insulin, how long, how many months or so of such, or should I consider buying food? It's some choices out here that are very critical. So you're taking a whole umbrella of a situation and have thought it out beyond just the service itself, but you thought of it outside of the walls of Zing. Y'all just too much for me. I just love it, love it, love it. Okay, let's get on to our next slide, please. All right.
Absolutely, absolutely. And so when you talk about Medicare Advantage plans, it's not to disparage Medicare because Medicare is a great healthcare system. It's just that when Medicare named Medicare Advantage, it's an advantage over Medicare because of all of the additional benefits that you may receive because of the out-of-pocket costs can be limited. And so these are just more reasons when you compare original Medicare to Medicare Advantage, these just give you more reasons to consider a Medicare Advantage plan. Because Medicare Advantage has to cover what Medicare Part A and B covers. For the most part. And so if you join a Medicare Advantage plan, you don't lose Medicare. You have to have Medicare in order to enroll into a Medicare Advantage plan. In most often cases, especially with the Zing plan, you'll receive Part D prescription drug coverage at no additional cost, as well as all of the extra benefits that we talked about at no additional cost. And there's a limit, I can't stress that enough. There's a limit on what you pay out of pocket annually for your medical care for services under Medicare Part A and Part B. And so again, if you want access to quality healthcare, and I'll say this, Claire, we just recently contracted with Rush Medical Center. And so we have a network of, a variety and wide network of doctors. And that's another thing, you know, we can connect you with doctors that you know and trust and make new connections, you know. So we have networks such as Rush, as I said, Advocate, Oak Street Health, and a plethora of others, Loyola, the Trinity Health System. And so, you know, it's a little give and take when you join a Medicare Advantage plan, but I know that, you know, the benefits will, in most cases, outweigh, you know, any of the things that people may come up against in terms of benefits. And again, benefits that will meet your needs. So again, we're really excited about all of the benefits that we're able to offer our members. And one of the big ones is dental. A lot of times people will join Medicare Advantage plans, and I'm speaking to my veterans as well, because a lot of times that's a benefit that they don't have access to. Not only do we give our members, all of our members, no matter what plan you join, access to dental benefits, but we give you access to preventative as well as comprehensive dental benefits at no copays for covered services. So on day one, you're able to access dental, your full benefit allowance at no out-of-pocket cost in terms of a copay. Now, you have a lot of plans out here to say, oh, we give $5,000, but you have 40 and 50% coinsurances associated with accessing those services. And in some instances, it makes it hard to access the service. If I need dentures, but I have to pay a 50% coinsurance, am I able to access that benefit? Well, with Zing, we've taken that into consideration. Our members have no copays associated with covered dental care.
Well, let's do this. Because you mentioned veterans, we were at one of our favorite posts, the Giles Post 87, and we were invited by Commander Frank Thompson of the Harold Washington American Legion Post 1987, there on 45th and Michigan. And this is just a quick excerpt of how Zing Health is in the community. Just want to share this with you. We'll be right back after this message. All right, that was just a quick little excerpt. When I tell people that Zing will come anywhere, to your red hat, your pink hat, your card party, step of sets, we do it all, because these advantages are for most of us. And let me say this too, as you mentioned, your partners and where you are, you're pretty much, when you say Rush, Loyola, those are in our communities. Oak Street Health, they're in our communities. So you've tapped the areas where it's more neighborhood friendly for us because we're familiar with those locations. So it's not out of reach that you can't get there. Oh, that's so exciting. And I think the partnerships are what really make the benefits of choosing Zing Health a true, nothing to think about. Zero copays. I could just think of, I'm still on the insulin, and I'm thinking about my dear aunt who doesn't live in one of the states, but oh my goodness, maybe she needs to move or relocate, because most people are not getting all of this wealth that you're offering. And I really commend the staff team and of course Dr. Whitaker in putting together the right people in place to make sure that we have health access, because everyone does not offer it. And it's just overwhelming. I just got a little emotional on that. But I think that is that should be our last slide. So how do we take the time now? What are the hiccups that we're facing? Because some of us, we late. We don't want to. I don't want. And some of us are what's the term I'm using? Some of us are very hesitant to ask for help. That is beyond just this Medicare maze. We're just afraid to ask for help when we're entitled to it, and there are loving people that can help us. What do you suggest to those who are listening?
Yeah, so one of the things that Zing Health offers, we have Medicare advisors that will come out to your home or to your business or to wherever you designate to sit with you to walk you through your Medicare options. You're under no obligation to enroll, but at least you can educate yourself about what your options are so that you can make an informed decision. And I would say for anyone, Medicare gives you this time every year to evaluate your benefits to ensure that you have adequate coverage for the following year. Because in most cases, most individuals will not be eligible to enroll outside of the annual enrollment period. So this becomes a very important time. And one of the things that I would suggest is that people not wait until the last minute. It's over in December 7th. We've gotten calls December 8th saying, hey, we missed it, and there's absolutely nothing that we can do unless they qualify for some type of special election or special enrollment period. So I would say, not to hesitate. If they just want more information, if they want someone to come and sit with them and explain and do a thorough needs analysis, our licensed Medicare advisors are trained and licensed by the state of Illinois to assist with serving them in this manner. And so I would say don't hesitate. Call before December 7th so that someone can sit down with you and provide you with a thorough needs analysis.
Yes. And now you do have those who are aging in.
Yes.
And is this a great time, or should we wait until we turn 65 to learn? What is your thoughts on that?
Yeah, so the great thing about aging into Medicare is that Medicare provides them a 7-month window.
Oh.
So 3 months prior to the month that they turn 65 or are eligible for Medicare, the month of their 65th birthday, and then 3 months after. And so they have a little bit more time depending on where they are in that 7-month enrollment period.
Wow. Well, I just want to say, if you could tell Dr. Whitaker, if he could develop one, I am only 51, but oh my goodness, the plethora and the wide range of services offered are truly a benefit to the community that you serve. It is a big to-do. So now we got a few more moments. We are as a matter of fact, we're a month and a few days into this period, which ends on December 7th. Hello, hear me, America. What are you facing? Any challenges? Are you getting calls? What is the stance right now? Are you seeing more people calling to get more information? What is it like in the field for your benefit consultants?
Absolutely. So again, as I mentioned, our benefit consultants or Medicare advisors are in the communities that we serve daily. We're daily. So you'll see us out in the community. Come and say hi. We'll be really excited to talk with you. But again, like you said, the annual enrollment period is every year. It starts October 15th. So you have from October 15th to December 7th. And some people are saying, well, what can I do during that time? If you have original Medicare and you need to pick up a prescription drug plan or a Medicare Advantage plan, you can do so at this time. If you'd like to change the plan that you're in, you can do so at this time. If you want to go back to original Medicare, you can do so at this time. So it's almost like while you were working and you had that period where you could change your benefits every year.
Yes.
And once you changed it, you literally couldn't make another change until the following year. It's something, it's similar to that. So that, you know, this is a very important period for Medicare beneficiaries. And I know that at this time, you know, Medicare beneficiaries are bombarded with TV commercials, ads, mail, phone calls, you know, making them feel like, you know, they have to do something. You know, we don't put that type of pressure on people. One of the things that we say is that let's sit down, let's walk you through your needs, and let's do a thorough needs analysis to understand the plan that you could possibly be eligible for. And the one thing that we will not do, if the person is not a good fit for Zing Health, then we're going to recommend something else. We're going to tell you about the resources that are out there and what's available to you.
And that is totally a truly unselfish act on behalf of Zing Health. I can't think of anyone else who would offer. Some people say, well, if it's not fit, good luck to you. We wish you the best. That is really a high consideration. And I think I haven't heard that happen before. So that's a big to do. Now, we're going to be closing out, but what can we do now? Some people, I mean, I don't have any loved ones, like my aunt. If she could relocate, I'd be glad to pass her on or just give her the information for Zing. But where can we go now? Where are you looking to go? How can we as a community help you reach more people? Are you tapping into other markets across the city? Where can we see and offer you an opportunity to be in front of other people as well?
Yes, so if you're interested in having Zing to come out and speak to your organization or to speak to your senior population, we are available. And again, you can call that number. We're available to assist, to come out and speak, to do, you know, educational seminars or just seminars on Medicare, seminars on how Medicare Advantage plans work, and also the resources that go along with Medicare, such as Extra Help and the Medicare Savings Program, which does assist people with those premiums and out-of-pocket costs associated with Part B and Part D of Medicare. So again, we want to be a resource to all those who are interested in educating, you know, their constituents and Medicare beneficiaries about, you know, their choices and their options.
Absolutely. So what we're going to do now, we're going to mention the number once again. It is 866-946-4458. That's 866-946-4458. The website is myzinghealth.com. You're watching and tuning in to this on Senior Talk with Claire Hubbard. You can find us on Facebook, Instagram, Twitter, LinkedIn, and many other platforms. This also will play on iHeart, Amazon Music, and Spotify. We are busy. But please do not deny yourself the opportunity during this critical time. We're not saying 866-946-4458. Call now. That's what they say on those commercials. We're not doing that. We're asking you to talk to a licensed benefit consultant and do yourself a favor and get the knowledge. We're educating you. We're not selling you. We're educating you. And so that's going to be critical to you and your family. So everyone, again, I tell you, it's been a pleasure to have you on with us. Sadia, you're so cool. I know you got something to do, but I will say thank you for your time and energy. Of course, you'll be joining us again in December for the close of our 3-part series. But Zing Health, don't forget they are turning 65, and you can give them a call at 866-946-4458. What is your closing statement at this time? I'm going to let you close us out.
Yeah, I just want to mention as well, because you spoke about if someone were to miss their enrollment period or miss this particular enrollment period. From January 1st to March 31st, there's something called the Medicare Advantage open enrollment period. So anyone who has a Medicare Advantage plan that maybe missed the opportunity to do that thorough needs analysis to ensure that they have the benefits that they need, Medicare gives them one more opportunity starting January 1st through March 31st. That's the Medicare Advantage open enrollment period. And they're able to make one more change at that particular time. And so I would just have your listeners keep in mind that if they miss this opportunity and they have a Medicare Advantage plan, they'll get one more opportunity during that time. But now is an important time.
Absolutely. So I just thank you again, and I thank Zing Health all the way from the top to where we are present, because we're all at the top together. And it's been a pleasure to have you with us. And if I can say this, in complete darkness, we are all the same. It is only our knowledge and wisdom that separate us. Don't let your eyes deceive you. I've been your dear granddaughter in the community, Claire Hubbard of Senior Talk, and we will see you next time. Everyone, take care.